The question is not if something is going to happen. It already happened, as was said by our colleagues from ORC. But the problem is things are going to be much more difficult and things are going to be much more complicated. I'm going to try to explain that to you. It's going to be complicated for everyone, but it's also going to be complicated for the poorest. It's going to be complicated for those that are migrating. It's going to be complicated for those that are living in times of war or protracted emergencies. And why? Because this is going to affect not only the people but the systems. Now, if you look at Burkina Faso, in the beginning of September, there was a flood. They received within 1 hour 25% of the rainfall that they used to receive per year. Can you imagine? The result of all this is the biggest ever, or the biggest hospital in the country, which is in Ouagadougou, is still closed 3 months later. So it is impossible to get any patient into the hospital. We haven't been able, the international community and the government hasn't been able so far to build a new hospital and not even to bring containers to replace the hospital. You have lost track of those patients from HIV/AIDS that were under treatment. These patients are going to die because of that flood. So I think the consequences of these natural disasters on the life of people are absolutely dire. In Manila, 2 months ago, floods again. Today, there are still millions of people that still have their feet into the water. The water hasn't receded because the urban planner hasn't thought of that. And therefore, you see that the consequences is you are fearing to have epidemics. You have to put in place efficient early warning system for disease control. If you look at France, which is supposed to be a developed country, in 2003 the heat wave has killed thousands of people and has had tremendous consequences politically, first of all, but also on the systems. I think the systems are not prepared to face this reality. This is extremely important. I forgot to tell you that one of the new phenomenon in the natural disasters, and particularly in floods, and that has been seen in Manila, is the psychosocial and mental health consequences. Half of all consultations nowadays in Manila are about psychosocial issues and mental health. So this is a new phenomenon. The effect is just that things are going to get worse. For the time being, malaria is a disease that you get from a mosquito. The climate change is going to give an environment which is much more conducive for these vectors to be able to thrive and to multiply. The result is, for the time being, 900,000 people, especially kids, are dying every day from malaria, and this number is going to be on the increase, even though we have the means to treat and we have the means to prevent. Number 2 is diarrhea, one of the major killers of children under 5. 1.8 million kids are dying every year. This is also going to be on the increase because of the lack of compliance between the sanitary and hygiene environment and the problem and the protection of the kids. So this is going to be reinforced not only by the lack of urban water and sanitation setting, because most of the problems are going to occur in the urban setting, but also because of the lack of provision of treatment in times of crisis and in times of disasters. I want to talk also about malnutrition. Malnutrition is killing every year 3.5 kids. And I think this is going to be very increased because of the drought, because of the rainfall, which is not going to be controlled, because of the food shortage and crop failure. We have the means to deal with malnutrition of the children. But in fact, we are not going to be able to cope with the situation unless we have a reaction, unless we are prepared for that.